ahead and kick this off. Again, we are so excited to have you for this month's series of the Impilo webinar. We host webinars every single month, leveraging our amazing partners and customers such as Iron Health, which we are privileged enough to have the conversation today. So we will be discussing empowering women's health and just speaking to Iron Health and their business and how they're incorporating RPM into some of their practices. So first and foremost, my name is Haley Minter. I am our marketing and demand generation lead here at Impilo. We are so excited to have you. And I want to share a little bit about what Impilo does before we dive into today's content. But essentially, in simple terms, Impilo handles the clinical side so that providers can focus on patient care. We're also handling the operational side as well and providing customer support in a multitude of ways. So Impilo is making providers our number one priority so that they can focus on their number one priority, which is patient care. Like I said, the provider handles the clinical side, we handle the operational side, and essentially we are enabling virtual care organizations to bring care into the home through connected device operations. Our plug-and-play platform enables RPM devices, supplies, and sensors to be used in the home, as well as providing a tech-enabled infrastructure to enhance virtual care offerings. A bit about our customers and who we serve. From private practice to digital health and everywhere in between, we have been lucky enough to work across a multitude of practices, from not only cardiology and emergency medicine, but also pediatric care and maternal care as well, which is why we are so excited to be here with Iron Health today. But before you can see some of the businesses that we've had the privilege to work with thus far, and looking forward to continuing to grow that network and support healthcare as we grow. So today, we are lucky enough to have Miss Christina Furlan, the Chief Product Officer and co-founder at Iron Health with us. Christina has a master's and bachelor's degree from Texas A&M University in biomedical engineering. She previously has led 2 internal startups at Philips and has held product leadership positions at Stryker and St. Jude Medical. She is an expert in digital health, women's health, and cardiology, amongst many other topics, and we are very excited to have her to share her insights with us today. So Christina, if you want to introduce yourself further and tell me a little bit about your role at Iron Health, I would love to hear it.
So much, Haley, and thanks for having us. We're really excited. I'm really excited to be here on behalf of Iron Health. As you mentioned, I'm the Chief Product Officer at Iron Health. I lead our product and engineering teams. And Iron Health is, in essence, a virtual care extender for the OBGYN. We partner with OBGYNs to empower them to serve as a true medical home for their patients by bringing a team of our virtual licensed healthcare providers to extend their scope of practice. We were founded a couple years ago out of the realization that the majority of women in this country no longer utilize family medicine providers to be their care home. Instead, they treat their OBGYN as their primary care provider. And as you can imagine, that comes with a whole host of challenges, both on the provider and on the patient side. But our mandate is to work with OBGYNs to take on all the care needs that come to them that are not obstetrics or not gynecology. And in doing so, our mission is to increase access to high quality, evidence-based healthcare for women across the country.
Awesome. Thank you for sharing, Christina. If you haven't checked out Iron Health, I highly recommend it. What they're doing is truly unique and amazing, especially as a woman myself. Seeing the impact they're making, not only on the care space, but women's health in particular, is just so inspiring and gives us hope for the path forward in healthcare. But as a co-founder at Iron Health, Christina, what really inspired you to get involved in women's healthcare specifically? What was the thought process behind Iron Health besides supporting the OBGYNs in providing primary care to patients?
Yeah, I love that question, Haley, because it was a really easy decision for me to move into women's health. I spent the majority of my career in cardiology and working on class 3 medical devices and the data and telemetry systems around them. But a couple of years ago, I found myself just feeling frustrated by the state of women's healthcare in this country and what felt like a real erosion of quality and access to care. And so when the opportunity to join Iron Health came to me, it was very easy for me to make that pivot because it made me feel empowered, like I was using the skills that I had to make a difference for women in this country.
I love it. And I always love hearing the personal mission, and yours is truly great. But want to jump right into our content today because I know we are limited on time, and I'm sure our viewers are very excited to get into our content. But again, make sure you're checking out Iron Health to learn more about initiatives that Christina and her team are working on. So let's chat a little bit about RPM in women's health and maternal care. I know through our conversations thus far, we've talked a lot about weight management. So how is remote patient monitoring being used in the women's health and maternal care space that you've seen thus far? And can you speak to a little bit of the benefits of perhaps implementing RPM into a care delivery system?
Yeah, I think if you look at different care pathways that relate to different phases in a woman's life, you can see a lot of different use cases for remote monitoring. Where we see it and where we use it most readily are around sort of peripartum care, for example, patients who might have gestational diabetes or gestational hypertension in particular, as well as you mentioned, weight management. So we use these tools for a couple of different reasons, and we can get into more detail around them. But one is access to really high quality data. We know from the literature and from everyday experience that self-reported data from patients isn't as high quality or high fidelity as data that we capture automatically. There are a lot of reasons for that. It's easy to transpose numbers. It's easy to fudge them a little bit if they don't look quite how you want them to. It's also really easy to forget to send us data. And so I think automating some of that and just monitoring that passively and remotely for our patients really helps them. It kind of takes the burden off of them to pass that information to us. But we also use remote patient monitoring as the foundation of some of our teachings around habituation and habit formation. And I'm sure we'll talk a lot more about this, but we feel like teaching our patients, whether they're coming to us for lifestyle interventions around gestational diabetes or gestational hypertension, or whether they're looking for long-term weight management solutions, building healthy habits and teaching them a framework and a skill set around how to do that is fundamental to the care that we provide. And we believe that remote monitoring helps us kind of supercharge that process.
Awesome. Yes, completely agree. RPM is great for automation and holding people accountable because it is completely doing it for you. And in this day and age where we have so much going on, anything that can be automated, especially for myself, I would prefer. So it is no wonder why your organization and your patients are seeing such improved outcomes from this practice. But I know we were able to collaborate not only on the webinar today, but on a guest blog that Impilo will be releasing later this week. So talk to me a little bit about Iron Health's magic pill for weight loss.
Yeah, our funny way of saying, like, we think we've cracked the code on some of the key things that people need to know in order to lose weight and keep it off over the long term. So one of the things that's wonderful about obesity medicine and weight management medicine right now is that we have so many tools at our disposal. We have some really effective medications that we're able to give to our patients, and they see great results from them. The downside to many of those medications is that we have very clear evidence now that unless there are other interventions that happen alongside of them, most patients are going to gain back at least 2/3 of the weight that they lose, often within a year of stopping medication. Now, some patients may choose to stay on medication for the long haul, but many are trying to use it to jumpstart their weight loss, but don't see themselves doing it forever, right? Like they don't want to be dependent on that medicine for the rest of their lives in order to maintain a healthy weight. And so we really try to partner what we're doing from a medical weight management perspective with a lot of teaching around habit building. So the very first thing that happens is that our patients meet with a registered dietitian who starts to educate them about sort of basic principles around nutrition and exercise. And I say basic, Haley, but when I look at the materials that our RDs create for our patients, I learn something every time. So these things that we all think we know, maybe we don't know quite as well as we think we do, and actually aren't quite that basic. So I think our patients really benefit from the education they receive from our dietitians as a first step. But the second thing that we do, and where RPM really comes in, is we teach them a framework around how to build healthy habits. Because I think it's non-obvious how to make behavior change really, really easy for yourself so that it becomes just a seamless part of the way that you're living your life rather than a real grind and something that takes a lot of willpower. So we use remote monitoring as the first habit that or as a tool to help us build that very first keystone habit, which is weighing yourself every single day.
I love it. Something that I initially took away from what you just said was the importance of education and advocacy. Um, we're all patients ourselves, we're all humans, and we all have received care at some point in our lives. And I know I have been confused or not understanding a condition I've had or a recommendation from a doctor. So just to hear how you are simplifying processes for your patient so that they feel not only empowered, but driven to ensure that they are receiving appropriate and quality care. Um, but I want to move into a little bit more about RPM and its use cases for weight management and how traditional ways that RPM has functioned may not suit certain use cases for RPM. So I know we talked just a brief bit about CPT billing codes. For those that are unaware, CPT billing codes are issued by CMS and allow you to bill for RPM. However, you need 16 readings in a month in order to have those reimbursement benefits. So obviously, when you are dealing with weight management, jumping on a scale every day at first time might not be the most exciting thing to do for a patient, especially a woman, when you're dealing with social norms and things of that nature. So how are traditional CPT codes not catered to the broader use cases in the care space? And what challenges have you seen because of this?
That's a great question. And maybe it helps to think a little bit about why the CPT codes are written the way that they are and sort of the history of how they've been used. A lot of them were developed around remote monitoring for chronic conditions um, that included some sort of technology intervention. So let me give you an example. Pacemakers and implantable cardiac defibrillators. A lot of the early remote monitoring use cases were around nightly monitoring of those devices to make sure that they were working properly, to see if we could um, identify any needs for reprogramming, to identify that a battery needed to be changed before it went kaput and the patient was no longer protected. So checking in on those every day or every other day made a lot of sense, really fit that use case. Similarly, when we think about weights, I think one of the original use cases for remote monitoring of weights was in heart failure patients. And we would ask them, and I think we still do, ask them to weigh themselves every day to get a sense of fluid retention because we were trying to use that as a proxy to predict a potential heart failure decompensation, which would lead to a hospitalization. So in those cases, it was really clear that monitoring every single day or every other day, as indicated by the 16 readings per month, was what adherence looked like, right? And so a lot of the codes that were written with those use cases in mind. But there are a lot of new use cases now, and I think part of that's driven by the kind of consumer quantified self movement, and the way that it has sort of driven quantification in other parts of medicine. And we see that those use cases no longer feel really relevant in all parts of care. So one example is the one that you brought up, where we're trying to teach a patient a new habit. And if that new habit is, for example, weighing yourself every day, you might not do that consistently at the very beginning, right? And we will use your inconsistency as opportunities to nudge you, as opportunities to give you encouragement toward building that keystone habit that we're going to later stack other healthy habits on top of. And so the idea that You have to get it almost perfect from the very beginning from a behavior change perspective doesn't really fit with the way that we know that behaviors are created. So in that case, you can see that there is a little bit of a disconnect between what we want patients to work toward and the way that reimbursement happens. Another use case on the complete opposite end of the spectrum, where you ask yourself, where does 16 readings a month come from, is something like gestational diabetes. So those patients are probably checking their blood sugar 5 times a day. And so adherence for a gestational diabetes patient looks really different than it does for a weight management patient. So it's pretty clear when you look at the way the codes are written that so many of these use cases for RPM and where we see it being really effective in helping us manage patient care were not envisioned and are not reflected in the way that reimbursement is done.
That is wonderful. Thank you so much for your insights. It is wild to see how these codes were first formatted and now seeing them transition into the future of healthcare. Obviously, there were some previous talks on the Senate floor about CPT billing codes, but those are on pause for now. But I'm definitely excited to see how those codes innovate and evolve to support all various use cases of RPM so that patients can really see the value that RPM brings to care delivery. But something that you mentioned that I really want to touch on is the aspect of gestational diabetes and using RPM to serve that. Um, for those of you that aren't familiar, gestational diabetes is a condition that causes high blood sugar during pregnancy. Often, these women are not suffering from any form of diabetes prior to becoming pregnant. And then also another use case that can be used for RPM is gestational hypertension. So this is when the blood pressure is greater than 140/90, about 20 weeks into the pregnancy. And then if they had normal blood pressure before and they're getting this reading, that's when they would be diagnosed. But RPM can play a significant role in managing these conditions in a multitude of ways. Healthcare providers not only are going to see improved patient outcomes because they're able to see these levels in real time and have timely interventions, but then they're also having a tighter control over those levels, making sure that any complications that come up are addressed very timely and that the not only the patient but their child is safe and well as well. Um, Providers are seeing with RPM for gestational diabetes and hypertension enhanced patient care, which Iron Health is seeing with their RPM for weight management. Like you mentioned, habit building and really educating and advocating for patients is making patients more engaged in their care. And that's something that significantly helps with adherence. If patients are more educated and motivated to be active in their care delivery program, then both sides are able to see more positive outcomes. Something that you mentioned too, that RPM is great in managing these conditions is that data. Um, Going off of our platform at Impilo, providers are able to see a comprehensive view of data. So like I mentioned earlier, they're really able to step in when needed in timely interventions to ensure that the mother is able to have the best experience of pregnancy as possible. And then lastly, providers' number one pain point, they want to reduce their costs and ensure that they're keeping patients out of the hospital for readmission. So with remote monitoring, really allowing mothers to receive care in the comfort of their homes. I know one day, if I'm a mother, that certainly would be more favorable to be cared from home rather than to be in a hospital and uncomfortable. But speaking of the patient, RPM has significant benefits for the patient as well that go further than convenience and comfort. It has the enhanced safety, so really giving them the opportunity to be connected to their doctor 24/7, regardless of their geographical location. And then, two, what you spoke to, that empowerment through knowledge. They have access to their data in real time, which just motivates them to have a healthier lifestyle, to ensure they have adherence to that program, and to make sure that they're connected with their provider as well. And then through RPM, we've able to see a new version of personalized care. It's more responsive, personalized, and treatment plans are able to be made in real time, which not only enhances that quality of care, but overall just creates a happy patient and a happy provider, which is what we want to see at all times. But wanted to touch a little bit about diabetes and hypertension because I know Iron Health isn't currently using RPM, but it certainly is a use case that is relevant and can evolve into different forms of care delivery. But I know with RPM, obviously, there are opportunities and challenges, as in any new technology in the healthcare space. So, Christina, can you explain some obstacles that you've seen in the implementation of RPM in your organization?
Thanks, Haley. I think there are a few. Certainly, one of them is the requirement that RPM must use a medical device. That's a challenge for us and for our patients because many of our patients will say to us, "Well, I already have a connected scale. It talks to my iPhone, and through your app, I can connect my iPhone data right into the patient portal, so my provider can see it." And the downside, of course, of the way that RPM is legislated today is that we're required to use a medical device. And many of the consumer scales that patients buy are not medical devices. And so that is a key limitation, I would say, of remote patient monitoring and the way that it can be paid for today. Similarly, there are all manner of devices that are collecting data about patients that we could bring into our system and we could use to better manage their care. Um, I don't know anybody who isn't walking around with a phone that's monitoring your steps and your activity. Many of us wear watches or other wearable devices that are quantifying our behaviors and recording biometrics throughout the day, all of which could be very useful and very valuable, but none of those are medical devices. And so, that limitation on having to use a medical device to do RPM, I think, is something that gets in the way for a lot of patients, both from a convenience perspective and for many patients from a cost perspective. So that's one issue. Another, I think, one challenge that we've come up against is related to gestational hypertension and diabetes, and that is the variability across different payers in terms of what sort of devices are covered for patients under DME. And so some standardization there, I think, would help us ensure that all patients can get access to this care, and then we can provide the right devices to patients that are always going to be covered by their insurance. Because again, some of these can be cost prohibitive, and that can be something that gets in the way of our patients participating in these programs.
When you're given these objections from patients, how has you and your team overcome these challenges? Are you coaching them on the benefit of perhaps buying into the program, or are you framing it in a different avenue?
Yeah, really, it's about the benefits. And I think anybody can buy a scale and start daily weighing. And if you're someone who's interested in carefully managing your weight, I would recommend that you do that at baseline because there's so much evidence that that intervention alone helps people manage their weight really effectively. So just buy a scale and stand on it every morning. It really is that simple. But above and beyond that, I think when you're trying to build a habit like that, having some built-in accountability from someone like a healthcare provider who's truly invested in your care and your well-being over the long term can be very, very beneficial when you're just starting out and trying to build that habit. And so one of the things that I love about patients using our scales, your scale, our scales, is that we have access not just to the data itself around weights, right, which we use to inform our care plans and to tweak things over time to make sure our patients are still seeing progress. For sure, we do. But we also have access to information about weighing behaviors. And that is something that is lost when we don't remotely monitor patients, when we just ask them to self-report on weights, is we don't know whether they're weighing themselves in a manner that is likely to lead to habituation. So, for example, are they weighing themselves every day, or are they reporting today's weight as the same as yesterday's? The weight itself might not change very much. The care plan around it might not change very much. But what's happening in that patient's brain in terms of learning that habit and cementing it is very different, right? If they're doing it every day versus every other day, there's great evidence in the literature to support that idea. There's also just less likelihood that that will become a long-term habit for them if they're not doing it at the same time every day, if they're not using a consistent trigger or consistent cue. So in addition to sort of wanting the very accurate data. We really want the data around the behaviors. And that is something that is truly lost if we're not using a connected scale that's plugged into our platform where we get all that additional data. And so by kind of putting that information in front of patients and letting them know that it's not just their weights that we care about, it's everything else around it that that we're monitoring and tweaking with them to help ensure they're successful. I think a lot of times we can get patients over that hump.
I love it. Really love how RPM can not only educate the patient by making their care program more visible of how every single action they have will have a direct impact in the long term. It's just wonderful to see. But want to chat a little bit about the future. One thing I love about working in healthcare is it's constantly innovating. Every single day, I feel as if I read something new about a new innovation or technology or just a various way to deliver care. So, with all of these changes happening as we evolve into the future, what trends or technology advancements or perhaps policy changes do you think will shape the future of RPM, not only for women's healthcare, but as care delivery as a whole?
Quite a few things, but I'll focus on a few that really excite me here. And one of them is that we're really starting to understand more about the brain science related to habit building, and this is more and more in the popular culture. And so I think the more that we realize that when we're monitoring people, we're not just collecting biometric data about them, we're also having a measurement effect, right? So that, there's this concept in physics of putting an observer in physics, it's observer effect, and consumer psychology, it's mere measurement effect. But it's this idea that simply by asking a question or interrogating or watching something, we change it. And we know that this is true both in consumer behavior and in health behaviors. And so I feel like more and more and more, we're going to start to understand that when we're monitoring someone, we're not just monitoring their biology, we're also monitoring their psychology. And we'll start to leverage more and more of that information in the way that we're caring for our patients, recognizing that what's happening in their brains is just as important to their success as what's happening in their bodies. So that's the first thing. I think the second thing is that we'll likely start to see more and more coverage for these types of services. One thing that really gets me down is that many of our Medicaid patients don't have coverage for RPM. Some do in some states, in some cases, but there isn't holistic and comprehensive coverage of RPM services for Medicaid patients. And that bothers me so much because of this measurement effect and because some really simple and relatively inexpensive interventions, like simply monitoring what's going on with these patients, actually have been shown to have an outsized effect. So just monitoring patients can, at the end of the day, end up being a very effective and very cost-effective intervention for many chronic conditions. And the idea that some of our most vulnerable patient population don't have access to that kind of care, it bugs me, and I would really like to see that change. And then we talked about this a little bit, but I think it's worth saying again that the more and more that we quantify ourselves, and the more our healthcare providers will have access to information about us that previously was just very inaccessible. And so I expect to see over time, just as we've been seeing more and more data coming in from consumer wearables and consumer devices, that our healthcare providers are leveraging to influence our care plans.
I can completely agree. It is incredibly frustrating to see that individuals in our country cannot receive access to care with these new technological advancements. But I certainly am hopeful for the future that there are some changes made so that all individuals can receive quality care and really see the benefits that different care delivery can serve, such as RPM. But as we move into the future, obviously Impilo and Iron Health are lucky enough to have a great partnership. How do you think our collaboration with each other is preparing for the future of not only healthcare, but RPM?
Yeah, well, it's certainly teaching us a lot. It's teaching us a lot at Iron Health. And let me say, for starters, the reason that we elected to work with Impilo rather than do this ourselves is because you allowed us to stand this up very quickly, right? So from the get-go, we were able to offer this care to our patients without having to build an infrastructure around it ourselves. And so I think that is for us an enormous benefit of partnering with you in this work. That and there is a very wide breadth of monitoring that is available to us through our partnership. So as our care pathways grow and as the scope of our providers' care grows, it's wonderful to know that you all can sort of keep up with us there, right? And once again, as we start giving or offering new forms of care through extended service lines, we're able to add RPM to those without making our patients wait for it.
Awesome. Love to hear it. One of the biggest things that we are passionate about at Impilo is not only starting but scaling these programs. So we're very excited to continue our partnership. And we had a lovely conversation today, but want to flip it over to our audience for a Q&A session. Feel free to throw any questions in the chat for Christina to answer or myself. But I'll give you about 2 seconds to do that. But Christina, while we wait, thank you so much for joining us. Your insights were invaluable, and I'm sure that everyone that attended gained something from this because I surely did. And I am so incredibly excited to continue to see what Iron Health is doing in the care space and then continue our work together. But we actually have a couple questions coming in. Um, we have one question that states, what would you say are the most helpful tools for you to implement good habits with your patients?
Yeah, great question. So some of them are really simple and easy, and some of them are a little more sexy and technology based. But some of the really simple and easy ones are teaching how habituation works in the brain and teaching patients how to habit stack. So we use a framework that is very similar to some of the frameworks out there that you may have seen, like the Tiny Habits framework or the Atomic Habits framework. They all basically say the same thing, right? Which is that you need to identify a clear cue. You need to have a behavior associated with that cue that is really small and effortless to do. And then you need to celebrate. And I think people forget the celebration piece, but that is a really important part of habit formation. So how this might work is I might say, and I'm going to share a real scenario with you. I'm trying to get better at push-ups. And so I say to myself, okay, after I step on the scale every morning, which I do, I'm going to do 10 push-ups on my bathroom floor. And I didn't start with 10. I started with 2. So I identified a cue. It's like a consistent habit or a consistent behavior that I do every day that I could stack a new behavior on top of. And then I picked the behavior and initially I made it really tiny. I made it like stupidly easy to do. Anybody can do 2 push-ups, right? And then after I do the 2 push-ups, say, go me, I celebrate for just a minute. And that celebration piece actually makes something really great happen in the brain where I'm more likely to want to do that behavior tomorrow. So that framework is what we teach our patients. And the way that we can help them with technology along the way is twofold. One is nudges. So nudges don't work for every behavior, but for habituating small behaviors, especially in their nascent stages, nudges are really effective. So if we see that a patient is struggling to habituate a behavior, we can nudge them through our app and through our chats. But we can also help them celebrate. And that is my favorite thing that we're able to do with them is to send them a little high five emoji when we see that they've weighed in or send them a little encouraging comment. Because so many times we fail to celebrate ourselves. And so that's a job that we can do for our patients that seems small, might seem silly, but there's a lot of evidence that it makes a big difference in habit formation.
Thank you for sharing. Love your direct example. Have to try that myself with my own fitness goals. But it's something that everyone can take away, not only in healthcare and your body, but every practice of life. I can't wait to see how I can relay that framework to other things that I do on a daily basis. But we have time actually for one more question, and that would be, what are some challenges that you and your team have faced in your efforts to expand higher quality care to women, and how have you navigated them?
Yeah, I love this question, and there are many. But I will share the one that has surprised me the most. And that is how much of our job seems to be convincing women that they deserve the kind of care that we have to give. I think there is a lot of messaging out in the world that we hear very early on and we start to internalize about the idea that pain and suffering are just inexorable parts of womanhood and that to be a woman is to suffer. And you see that in many phases of a woman's life, where it's in a peripartum journey or a perimenopausal journey or anything in between. Women are conditioned to believe that life just kind of hurts a little bit in a way that I think men aren't. And so, one of the challenges that I did not expect us to face, but that we do, is convincing women that they are worthy of care, that they don't have to suffer in silence, that what they're going through is a shared experience, and that people are ready and willing to help them. And so it's incumbent upon us to tell those stories to women and to help them unlearn some of these beliefs they have about what they deserve and what they're worthy of in terms of care.
I absolutely love it and absolutely love what Iron Health is doing, not only for your patients, but just as you continue to grow. I can't even imagine how much your services are going to positively impact people. But this was a lovely conversation. I'm sure everyone that watched can take something away and even take the habit form framework and apply it to their own life. But with this, we'll wrap. Christina, do you have any other final thoughts that you would like to share?
Thanks for having me. It's been a wonderful conversation. Appreciate you, Haley.
Yes, thank you so much for joining. To our attendees, thank you so much for joining. Always happy to share some thought leadership with you and Christina. We are so thankful to have you on today. But like I said in the beginning of the call, we host these webinars monthly on various different topics. So feel free to keep up with Impilo's LinkedIn as well as our website for those updates. And then be sure to check out Iron Health and all of the great things that they are doing in this healthcare space, specifically in women's care. What they're doing is truly unique, and I am sure that you will find value out of it and take something away. And in the meantime, Christina has been generous enough to partner with Impilo on a blog speaking more towards their magic pill. That will be coming out later this week, so keep an eye out for that. But until next time, thank you for joining.
Thank you.